But the meaning of life, I think, is to find what you're to be and be it. And what's lovely nowadays is we don't have to stay. We all went into one career like you did.
Yeah.
But thank God you can pull out of that, and there's so many avenues available that weren't available before, which is wonderful. So to follow your dream, never think that you can't have it. No matter what you want in life, you can get it, as long as you don't trot over people, which I wouldn't want. But you can attain whatever you want once you have that self-belief. That's absolutely true, and I've certainly done that, and you've done it as well, Laura, which is lovely. So the meaning of life is to be the best person you can be good to people along the way.
There is definitely something about Mary.
Thank you so much, Laura.
It is.
I can say the same of you.
It is an absolute pleasure to have you, Mary.
You're very welcome.
Know that we can delve into so much. You are an endocrinologist.
Yes, absolutely.
Can you explain what that is?
So endocrinology is the science of hormones. So hormones basically control every muscle, all your immune system. They basically dictate everything. And I suppose we all talk about them. We know at time of puberty how boys and girls change. I only heard a woman saying that her daughter was real sporty, real tomboy, and once she turned and had her period, suddenly she's all into makeup and suddenly, and of course what that is estrogen, the fire of estrogen. So we realise this, but yet we don't, and that's why I really brought it into the open, because like we all know what estrogen does, what testosterone does, but we really don't think about it. It defines people, it defines you as a woman, it defines you as a man, and it defines all your emotions and everything. So it's not just estrogen, testosterone, it's all hormones. And we have a hormone control center. You've heard me talk about it several times, on the top of our nose, and that basically is the master of the orchestra, and it controls everything. And your hormones are coming down to every single muscle. People forget the bowel is a muscle. So if your circadian rhythm is off, if you're overtired, particularly as women, if we have heavy periods or perimenopause or menopausal, if that FSH level is off, which is the hormone that pushes the ovaries and pushes the lining of the womb and all estrogen receptors, if that's off at all, then the circadian rhythm is off. Likewise, if you're overtired, if you've had an infection, a viral illness, not sleeping because of a child or whatever, your pituitary gland is tired. And once that's off, your hormones at every nerve muscle junction are off. So that's why you get the aches and pains of the muscles. That's why you might have bloating, passing wind, belching, which we traditionally called IBS. That's why you might have problems sleeping, because your hormones, in order to have deep muscle relaxation, you have to be able, the hormone balance has to be right. So there's so many things that people have just fobbed off for years. When they get headaches, they're thinking, oh, is this in my head? And of course, usually it's hormones off at every nervous junction. Could be a bad period, could be due to PMS, when, pituitary is tired, is not able to take that high LH going up when there's ovulation. And as a result, there's a knock-on effect with hormones. So I suppose what I want to do, I love endocrinology. I was actually going to be a cardiologist until I met the late Professor Gerald Tompkin, who unfortunately died this year, but he just fascinated me with the whole hormones and really opened my mind up to what they really do and how we can do so much to help our hormonal health, because in essence they control everything, and that's where it all starts and ends. So there's so much we can do to help our hormonal health. That's really why I needed to come out and talk about hormones and take it away from the narrow little beam that we all were in.
And you were one of the first, you really are a trailblazer in that respect. And we have to give it to you, because you've been talking about hormones and menopause and perimenopause for years. You've been traveling around the country doing it. Yeah. Now it's really taken off. Unfortunately, Joe Duffy is the face of menopause for Ireland, because he went on the radio and was talking about it a couple of years ago. But really, you were doing it from such an early time, weren't you?
Yeah, absolutely. And I think it was because being a woman, we hear women's stories. We can empathise with women because I'm a woman. And I heard the awful stories of women in their 70s telling me how much they'd suffered, women in their 50s, women who went into early menopause, and they just were crying out for help. They didn't know what was going wrong with them. There wasn't enough of an emphasis on menopause. It was just fobbed off as one of those things you have to deal with. Women didn't talk about it or weren't listened to. And really women's health was left left in the doldrums. So that's why I spoke out, and I have to thank Lorraine Keane, because she came around and emceed those, because I was a nobody and she was known. So at least the lectures I did around the country, you know, people attended them, and that's where it all started. And then thankfully Joe Duffy, who unfortunately I never get time to listen to because I'm working, rang me and said, his researcher rang me and said, will you come on? And I was a little bit hesitant, but then, you know, he's got a huge listenership, and I said, you know, yes, we have to do this. And once I came on and spoke about it, you know, loads of people rang in, and sure, I think there were 2 weeks on the airways, which was absolutely wonderful. But it was just talking about what was very natural, which is an event all women go through, be it naturally or surgically. Most of us will go through naturally, thank God. But it was something that needed to be talked about, brought out in the open, no shame in it, and just educating women and empowering women that, you know, we're equal to men, which we weren't brought up in society to be, but we are equal. We're different sexually, and we should be celebrating those differences. Once you know, you can deal with it. So if any of us know what's ahead of us, we can prepare for it. Absolutely. And that's the key.
So in your practice, obviously you see lots and lots of women. What stands out to you as what women are lacking in their lives? And they come to you, and I think I know the answer, but I'd like you to say it.
Yeah.
What are women not doing for themselves, and what that they should be? So
self-esteem, self-belief in women, that's been the thing. And that's really what brought me out, was that, you know, the majority of women, even the most amazing women, they were never told how fantastic they were. And I think this goes back to childhood, that, you know, back, and I'm still young, or count myself young, but, you know, parents are brilliant, but they themselves, and they're, you know, brought up in the 30s in tough times, they probably weren't told how fantastic they were. So therefore they did their best to rear us. But if a child isn't told by her mother and father how fantastic she is, how beautiful looking she is or he is, then they don't know. And they go through life not realising how fantastic they are. And particularly in women's case, traditionally Irish women, I know it's changed now, but traditionally, and I come from a foreign background, so I could sing about this, traditionally, you know, women coming from a farming background or a rural background, mothers always would have put the son first. It was what was done, because, you know, you brought him up and he went on to inherit the farm and so forth. And the girl, while she was, you know, fabulous and given her brought up, she still knew she was never going to inherit the farm. And that in itself gave that girl a lack of self-esteem. She never was told how fantastic she was, because they always thought she'd get above herself. And this is what I would have heard from loads of girls.
Maybe get a few notions, God forbid.
Yeah, exactly. Yeah. So they went in then, and through the life, they were working really hard to become visible to themselves, because they were never told how fantastic they were. And as a result, I have amazing teachers, CEOs, nurses, doctors, secretaries, all of this, complete cleaners, all of this fantastic array of women who are coming to me with hormone imbalance due to thyroid, due to whatever it is. But the underlying problem in a lot of them is that they're overdoing it. They're not eating healthily. They're not getting their rest. They're putting themselves last. And it's because no one ever told them how fantastic they were. Now, none of their parents consciously did that. I want to spell that out. This was done unconsciously. And it was about me changing the narrative and saying to mothers and to daughters and to fathers, listen here, it's, you know, we have to start treating men and women equally. We have to do it in sport. It is to be seen to be done. It's not just enough to talk about. For example, in sport, I've got a boy and a girl. In camogie, they're lucky if they get a medal. The boys, there's a huge thing made of it. You know, it's not covered equally as we know on television.
Actually, I was speaking to Dr. Lisa Cunningham. So she actually works, she's a mad GAA fan, and she works the ladies football team up in Mayo, and she was saying if something happens, one of the male players, they get seen to straight away through the system that's just looked after. They don't have to pay. Yeah. Whereas the girls, they have to pay to see the doctor. Now, they might retrospectively get it back, but they could be out of pocket for a few months and they're not seen immediately. Absolutely. So that in and of itself is showing that there isn't equality.
Only last week I had a patient who has a son on the Clare football team and has a daughter on the ladies Clare football team, and he said it was shocking. He said that she had to pay for her bus fare, pay for everything. The son got it for nothing. And the very essence of that, those little girls are seeing that disparity, and then they're seeing themselves unequal, and they'll carry that through life, in their health, in their marriage, in all their relationships. It's so wrong, and it's up to fathers, mothers and society to stop doing it. And there's huge of our taxpayers' money going to Sports Ireland, being passed on, but it's not being passed on equally. And it shouldn't have to be for us to stop. Unfortunately, we have to call it out, but it shouldn't have to be called out. But I am going to call it out. And oftentimes, I've had particular men in particular saying to me, telling me, oh no, you're very strong. Well, I'm delighted I'm very strong, because I see this as a huge problem. And unless it's dealt with, and unless it's tackled, unless there's equality right across the board, the hormonal health will always suffer, because the men and women who haven't been treated equally will always have a low self-esteem, and then won't do all the things that I need them to do to look after their hormonal health. So it's so important. So I will keep beating about the bush until it happens.
And then in terms of ladies coming to you, we're going to talk about thyroid, because it is a huge issue.
Yeah.
But and you do love to talk about the pituitary gland and it getting tired. So your typical woman that comes to you in her 40s that's just exhausted, what do you tell them to do? I have heard that you're known to phone the husband up and tell him to come in because he's sitting in the car waiting.
Well, I always do that if she tells me, I do. But she absolutely, just so, because it's so important that, I'll give you a classic situation where I would see, so say a lovely teacher, about 37 years of age, she has 3 kids at home under the age of 7, right? And she is getting up in the morning at 6 o'clock. She wants the hour to herself. This is the classical thing I hear from women. I just want some me time, right? So they get up at 6 o'clock, and she may or may not do a workout. She then does everything for the kids, and then drops them all off, and then comes home, after does the homework, makes the dinner, cleans up everything, and then she's pottering around the house, because all those women love her house clean, and it's part of a feminine thing. I love my house clean too, and that's fantastic. And then at 11 o'clock she's whacked, and she goes to bed and then can't sleep. And the classical thing there is that her pituitary gland is so tired, because remember, she's having periods every month as well, so that's taking it out of your pituitary gland too. But she basically is go in her teaching job, in her home life. And when I would say to her, so she'd be coming in, energy levels are 2 out of 10. Women don't, or men don't come in unless they're exhausted. I keep saying that to people. People don't go to a doctor unless they've more to be doing. So when they come to me, they're whacked. So her energy level was 2 out of 10. She had severe headaches, periods were all over the place, and she just couldn't function, and she was very emotional. And what was wrong there? Pituitary gland was exhausted. As a result of that, the adrenals were exhausted. She was emotional, because you need your cortisol levels to be working to be able to deal with emotion, and hers weren't. And she wasn't sleeping, because once you get overtired, the hormones are off at every nervous junction, so you don't get that deep muscle relaxation, but also you have too much adrenaline in the system, particularly at night. And a lot of people listening will know that when they get overtired, they get palpitations at night, they can hear the heart thudding in the ear, and all that's wrong is that they're overtired. There's huge adrenaline release trying to get the muscle receptors to take it up, but they won't take it up because it will flog them. So what happened, I needed to explain that, or obviously examined her, took a full history. She wasn't eating right, obviously, either. She was making sure the children ate healthily, but wasn't doing herself. And that's a classical example, unfortunately, of most women. So I needed to, first of all, explain all the symptoms, explain why she was the way she was, and as well as getting things right. So in that particular case, I think she had an underactive thyroid as well, and I had to deal with that. But there was no reason me dealing just with the medical part of it if I didn't look at her lifestyle and say, listen here now, you can't keep going from 6 till 11. You've got to pare it back. What's your husband doing? He was a lovely teacher as well, but she was leaving him in bed till 8 o'clock, and she was letting him off training teams. But she was absolutely exhausted, and this couldn't go on. So I just said, look, you have to, it's up to you to ask for help. It's up to you to say, listen, darling, you'll have to tone down now on the training for now, because I need the help. And she needed to, let him help in the morning, and also maybe to find some time out for herself where she did yoga or whatever. Yeah. And really, really pare back, get the diet healthy, get her 8 hours sleep. And lovely if you want to get up at 6 o'clock, but if you're dragging yourself out of the bed, that's not good. So it's time for women to listen to their bodies. So I suppose to explain all that, and when I brought him in, he was very, very delighted that she was going to be all right. He didn't know what was going on. But traditionally men would say, when I'd say, you need to take it easy, he'd say, yeah, but sure, I'm telling her that all the time. Yeah, but I'd say, that you also have to step up here, and don't be waiting to be asked to step up. Yeah, that's the thing.
And it's more that, like, it's I think as a general rule, men want their wives to be happy.
Totally.
Of course they do. They're the mothers of their children, or not maybe, but they want to live with someone that's happy. And I think men are very good at, saying, oh, you do need to take time for yourself, but they're not very good at like allowing that to happen because they take care of something else that the woman would have been doing in the first instance. So it's about having that two-way conversation, isn't it?
And I suppose when you study it, they're very empowered because that's the way society has brought them up. Society, everything, is meant. For example, I had a woman in yesterday and she had a baby after many times trying, and she came in to me to show the baby, who was absolutely gorgeous. And I said, now I hope this child is a double barrel lamb. She said, no. I said, I don't believe it. Because I just think we need to do that as women, just to put our surnames on with the children, like they do in Spain. Down the road, they can do what they like. But it's us putting our identity on the child that we have carried for 9 months, and yes, it's up to everyone to do it. But I just think there's no harm in having it even on the birth cert. Yeah. And then you can decide down the road what to do. But I just think women need to value themselves a lot more. They really need to see themselves as equal because men are empowered. That's why they look after themselves, love themselves, and they should do that. And I'm absolutely congratulating them for doing it. But we need to do the same. And it's up to us as women to love ourselves, to realise we've only one life, to really live it our best. And in that we have to look after ourselves. So like on the airlines, you have to attend to your own first. So it's up to us to love ourselves enough to say, right, I'm going to eat healthily. I'm going to get my 8 hours sleep. I'm going to put the boundaries in place and say no. I'm going to delegate. I'm going to get the kids to do the rota. I'm going to get himself to make sure that they do it. Because all this giving out to children takes energy. You don't have to give out at all. You used to say, darlings, this is what you're doing. You say, darling, you oversee it, and I'm lying down and I'm watch homing away, or whatever you want to do. So I think that's where we need to change as women. But society needs to be made change too, and they're half doing it. I mean, you see there where they're now on the board with the sports, they're going to demand that it's 40% women are on the board. Why not 50%? So, and they have to be shamed into coming up to the 50%, which isn't right either. But I think as women, we have to realise we have great power. We don't use it. We have great power of voice. Look what happened with the menopause. We completely took over the airlines in RT for 3 weeks. Yeah. And as a result, they had to make change with government policy, which is wonderful. But, we need to realise we have that power and we need to use it. And I think that's, as women, and what we need to know, we're not only doing it for ourselves, we're doing it for the generations to come. And as I always say to my children, if I'm bringing my girl up, equally, she is going to be a better mother to her son and daughters in the future, not just to the daughters, but the best gift you could give a child is high self-esteem. And the only way you can give it to a child is if you have it yourself. And if you have a parent who's high self-esteem, they will pass that on to their children, both men and women. So I don't understand why society isn't doing this all along. Because if we want to improve society, if everyone has a high self-esteem, then they're not going around with chips on their shoulder. They're not bullies. They're not, abusers. So I think we need to really look at that. But the only way you'll do it is treating men and women equally, because that's where the whole thing starts.
And Mary, you've practiced medicine for years. Did you always have the self-confidence that you have now, or did you come up against, sexism or the fact that you were a female, and did you have to kind of? I don't like the idea of fight your way to the top, because I can't imagine you doing that. But no. I suspect you had to be, quite authoritative.
Yeah, totally. So I suppose I told you about how I'm coming from a farming background. I actually love animals, and the only reason I didn't become a vet is because I wouldn't want to put them down. So that's the reality. I absolutely loved animals. I would never let my father sell the cows because they were, those ones I'd got attached to them. We kept them for ages. But yeah, I was the oldest of 4 and came from a farming background. And as I said, I loved it. And because my father was also general manager in the local Castle brand, which did all the saucepans and road signs, I was very much involved in the farm. And as I say to my kids, we cycled in and out, rain or not, into school. So it was very, very busy before and after. And regardless of whether you were doing leaving or junior, you still had to do all your jobs. And I was very involved in farming. But I always knew that no matter how brilliant I was never going to inherit the farm. And that sort of eked at me a little bit, so I suppose that defined me a little bit. And then I went on to do medicine, and I absolutely loved it. Went to Trinity College, which age was tough as a country person, because back then it was very much Dublin and a lot of Presbyterians from the north. They were fabulous people, but just it took me a while to fit in, being from the country. And I suppose I hadn't been mixed much either. Back then you didn't travel much beforehand. But thank God I made great friends, and I loved it. And I loved medicine for the word go. But yes, in medicine, naturally it was very much male dominated at that time. And now thankfully there's way more women coming in. But yes, when you were good and when you started reaching heights, you would, I felt as a woman, had to work harder. And also I remember a few men when I, did very well, they'd say, God, you're tough. And of course I'm not tough at all. I'm actually a real softie behind it all. And my kids are constantly giving out to me for it. But a lot of men do that as sort of a put down. But I thankfully used to say to them, well, I see that as a compliment. And of course you've taken away, because they want a reaction. You're not giving the reaction by doing that. So maybe the child thing defined me a little bit. Maybe, and I love medicine, and all women in medicine do have to work that little bit harder. And it's still not equal, and even that whole HPAT thing is a joke, because it was brought in to, because there was too many women going into medicine. And they'll all say it wasn't, but it was. That's the reason it was brought in. And it's an awful stress on people who would make brilliant doctors, and they're getting 625, 600 points, and they fail the HPAT, or they don't get enough of the HPAT. It's absolutely wrong. And we're crying out for doctors, and we're not letting people in just because we want a gender balance. They've got rid of it in Australia where they brought it in. Why don't they get rid of it here? And the cost and the stress of it is just ridiculous. So I'm going to make that point. But anyway, the thing is that, probably my childhood defined me. Yes, I absolutely love Trinity. I think I have a real sense though of fairness, and I think that's where the whole women men thing really, I kept seeing in patients, women coming in, heavy periods. I felt this should be prevented at an early age. Why isn't it being spoken about? There was nothing about periods. Women were hiding the Pampers under the slice of pan. The injustice was always, very stark to me. And then I think when I became an endocrinologist, I really saw it, because I was dealing with menopause, perimenopause, thyroid, and hearing the stories. And I was always looking beneath. I suppose the scientist in me is always looking, what's the reason? I'm always trying to figure out what's the underlying reason for this, because there's always an underlying reason. Women coming in with infertility, a lot of the times those women would have been just overdoing it, absolutely trying to do everything. And then these amazing intelligent women overdoing it, how could their bodies have time to ovulate with the fact that they were never sitting down? But they didn't see it until I pointed it out. And I often wondered, why is it I have to point it out? They're so intelligent, they should be able to see it for themselves. But these women were working so hard to be visible to themselves, because the reason they attained such heights is that was giving them self-confidence. But underneath of all, their self-esteem was low. So they had to deal with that low self-esteem to be able to say, you don't need to be killing yourself to make yourself visible to yourself. You should be visible to yourself. You should be realizing how amazing you are. You don't have to go off and do all these things, And when you'd point it out, they'd always say, Dr. Ryan, you're right. I feel so much better. I'm going to pull back. But I always had to point it out. And I thought, I need to get this message out. Because time and time again, I was saying the same thing over and over. You've got to pull back. You've got to really, And
isn't it funny, Mary, because sometimes people think they have to go to the doctor, and if they go to the doctor, like a typical example is if people go to the doctor and they've with an infection and they don't come out with an antibiotic, the doctor just tells them, paracetamol. Yeah, like that was a waste of money. Yeah. But in actual fact, when people will go to someone like you and they're just exhausted and they literally need to be told they need more sleep, they need to a better diet, and they need to exercise a little bit, and that we should know that about ourselves. It shouldn't take a doctor to have to tell us that.
Absolutely, yeah.
And I think that we probably live in a society where people are they feel better about maybe taking a tablet to fix the issue as opposed to the underlying one, like what you're talking about.
Totally. But I think also when they do come in, you're doing a full examination on them, because like tiredness can be due to this, but it could be an underlying breast lump or something. You know what I mean? So it's important that they get it checked out. But it's lovely in the majority of cases when it's just the pituitary gland is tired. Do you know what I mean? Yeah. But I think that's the key thing, that you're listening to them. I think very important. I tell all my medical students, you've got to listen to them. A lot of people aren't listened to. Very important to listen to patients and to ask the right questions, to really get beneath what's going on. Examine them, give them a proper examination, because that's reassurance for everyone. We're all human at the end of the day. We're coming in worried because we are worried. It's not in our heads. We're worried. And then then you sit down and you say, right, the examination showed this, could be muscle pain, could be whatever. Everything else is fine. Your blood work is fine, but this is what we're going to do. And then I draw a diagram, if it's the pituitary is tired or whatever, and I show them exactly. And the key thing is that they understand going out the door what's wrong and what they need to do. So it's arming, it's putting them, giving the control over to them, but knowing that I'm 500% behind them. That's the key, I think.
Yeah.
Do you know, and I say that to my medical students, that I think the listening in medicine is so important. Everyone deserves to be listened to, but they also have to be explained to them. Do the diagram, because, you know, they're so overwhelmed. You want to make sure that you give them all the knowledge, and the diagram is very, very good as well, because they can visualize it as well as hearing it. And I just think they go out then, they're reassured, and that's fantastic.
So when someone comes to an endocrinologist, would you always take blood work initially to screen for any kind of thyroid issues? Or
so if I was referred to a patient with thyroid, I would ask them to bring bloods from the GP usually, where they'd have a full blood count, the renal profile, kidney profile, liver function, thyroid antibodies. I'd also want B12 and vitamin D, because if they were low in B12, that's an autoimmune thing where antibodies attack the B12 cells, and that can go hand in hand with thyroid. So in thyroid disease, it's much more common in women, and you have two types. You have an underactive thyroid and you have an overactive thyroid. The underactive thyroid is usually caused by antibodies attacking the thyroid gland. Usually it's in women, and my hypothesis is it's because women overdo it. Women with estrogen, when estrogen starts going up and down, it can create an autoimmunity as well, which is where the immune system attacks itself. But predominantly, I think in women, it's because we're overdoing it. Pituitary gland is tired, and when it's tired, then the immune system is affected, and that means then you have antibodies attacking your thyroid. So the most common form is Hashimoto's, and there's huge research coming out about this now. It's very, very well treated, but you also have to adhere to lifestyle advice, good healthy eating, less processed food, because that inflames the immune system. A gluten-free diet does help, research is showing lately. Now, I don't let patients go on a total gluten-free. Of course, if they go out with you for a cup of tea, they can have it, because they're not totally celiac, but by and all, they try and adhere to a gluten-free diet. And selenium has been shown to help as well. And this is all just trying to stabilise the immune system, but you do it with eating healthily, pacing, getting your 8 hours sleep, getting your energy levels back up to 10 out of 10, because that's going to get your antibodies under control. And then on top of that, you obviously have to give them thyroid medication. So it's about a holistic approach.
Of course.
And then with the overactive thyroid, it's again caused by antibodies attacking the thyroid, maybe a little, what we call a hot nodule in the thyroid usually. And we give them a medication usually to bring that to normal. You can do 3 things: medication, surgery if they've got a huge big thyroid gland that's growing and compressing, usually on the windpipe. You would really only do surgery for that, or if you're concerned that one of the nodules was gone, what we call a cold nodule, and might be looking a little bit suspicious, and then radioactive iodine. But for the most part, we actually are doing medication, which works very, very well. And again, you have to do all the stuff I said, right? That's really important. And usually after about 18 months, you would hope to wean off the medication. You will do very well if they do everything you tell them. So there's so much in our own control of controlling our hormonal health.
Weaning off the medication for hyperactive, but never for hypo.
Never,
isn't that
good
right?
girl.
So
Thanks for pointing that out. For hyperactive, we try and wean it off after 18 months. For underactive, you to stay on it forever. Yeah. Absolutely forever. Unfortunately, it doesn't. The thyroid gland, once attacked, doesn't come back to normal.
And is there a link with when women get a little bit older and they go into perimenopause and menopause? Is there a link with an increase in thyroid issues?
Yeah, totally. And believe it or not, after having a baby, after labour, we see it a lot. But again, I think that's because women, labour can be really long for some women. I know myself, I didn't sleep for the 2 months coming up to having the children, because you're just so uncomfortable. So you're tired, your pituitary gland is tired. And then a lot of women, and I'm always saying this, once they have a baby, they're putting themselves under huge pressure, to be a super mum. And I think we need to stop this. We're amazing after having carried a baby for 9 months and bringing a miracle into the world, and they're miracles and they're the best thing that ever happened, right?
Yeah.
But I just think as women, we need to congratulate ourselves and say we're amazing, and then, get all the help we can get, which was actually used to happen years ago, but isn't happening now.
Mary, that's
one of the
isn't
big
it?
problems.
We're very isolated now when we're having our babies.
Yeah, totally.
And, we don't, because when I was growing up, the neighbours were around, and the neighbours would pop in and out. You know, you'd be sitting eating your dinner and the neighbour would pop in and have a cup of tea while you're eating your dinner. And kids, you know, if mum went to the shops, our next door neighbour would be keeping an eye on us. We could be right in the road. And there was very much a sense of community. And even, you know, with a new baby, mums would be around or aunties would be around. Now we're very isolated. And I think that women are literally dealing with this newborn all by themselves. With Instagram to look at and the snapback bodies that they're insisting that people, you know, should have after having a baby, which is utterly ridiculous.
Absolutely. And I think I told you I got terrible maternity blues myself because I had twins. I started off with twins and one of them ended up being in the incubator in my hall for 3 weeks, and it just was an awful whack. I wasn't expecting it. I had a terrific pregnancy. The last thing I thought of was that I was going to have one boy that was touch and go, and it was touch and go because I was told that I woke up in the middle of the night once to say that I have to use an oscillator to get him breathing. But it was all the trauma, and my hormones just absolutely crashed. And it was just, I was overtired, I hadn't slept well, but thankfully I with great support I came out of it. But that's the point, we're all human. If any of us get overwhelmed, our pituitary glands will get overtired, hormones will go all over the place, and we have to stop thinking we're superhuman. So when we're having a baby or when anything big is on, or if you have loads of young children at home, and you just need to ask for help and you need to say, no, I need you now to take over and I need to rest. And women, that's where empowerment comes in of women, that we have the power to love ourselves, but we need to do it, because we're no good to anyone and our little baby if we're sick and if we're irritable and if we're tired. We're no good to them. So we really have to have that self-confidence and that empowerment to actually, ask for the help.
I think a lot of baby blues, like what you're saying, is serious overtiredness for women.
Totally. It is totally that. And that's why, thyroid disease is I see a lot of it around then, because women are just, overwhelmed. They're trying to feed the baby. They're up at night. And a lot of women say to me, I always say to them, if you're really getting overtired, go into the spare bedroom and let him take over. Because a lot of women say to me, they're lying in the bed with the man and he never hears the baby, because of course he's empowered. He knows that she's going to hear it, so therefore he switches off. But it's up to the woman to go across and say, then when he's in control, he knows he has to wake up. Do you know what I mean?
Yeah.
So it's things like that when you get to that stage, and try not to let yourself get to that stage as well, because you're nearly rock bottom at that stage.
Yeah.
So it's just about loving yourself enough to realise that, listen, I'm human too. I can't be superhuman, and I've brought this amazing little miracle into the world, but I need to mind myself in order to be able to mind everyone else and the baby. Do you know what I mean?
Absolutely.
And have that,
And with hypothyroidism, so when someone is producing too little thyroid hormone, what are the symptoms of that? Because they mask menopause too, they kind of interact. So can you just explain that? So if anyone's listening, it will encourage them to go and get the blood test.
Yeah, absolutely. So if you have an undirected thyroid, you'll notice that you're putting on weight. Now I'll explain to this and bring it in with the menopause thing, because you're so right. So they put on weight. You could have very dry skin. You could have very dry hair. You can feel very, very lethargic. Now you're so right. Some of those overlap with menopause symptoms, and in fact all of them do. Right. So the big thing is to get your thyroid checked, and of course then your doctor will be able to take history and see, are you perimenopausal, or are you or have the period stopped, and are you menopausal? But it's really important to because when your pituitary gland is getting overtired around perimenopause, menopause, or at that time when you're overtired after having a baby, of course you can get antibodies that'll attack the thyroid and drive it either overactive or underactive. So the underactive really is very equivalent to a lot of symptoms that women have. So just very important to get it checked. And if you have it, yes, you're going to be on medication for the rest of your life, but remember, you'll have another 50 years left and you're going to be rocking it and kicking it, and that's what we want you to do,
I had a couple of questions in about the T3, T4, Armour thyroid and all of those kind of little medications, because some people, they don't react well to L-Troxin, so they need to change on to another thyroid medication, which is unfortunately not licensed in this country and costs an absolute bloody fortune.
Yeah, so the majority of patients, thank God, do well with T4 or L-Troxin, and I to be honest, I could say that 94% do, right? But I do have that 6% that just don't do well with T4, and it is genuine. So those patients then need the T3, and they do very well on the T3. Now, some patients were able to do a combination of T4 and T3, and that works as well, and that sort of brings down the cost, which is good, because it's crazy expensive, as you know. So we do that. But no matter what medication you have them on, if they don't do all the other stuff as well, like, pacing, healthy eating, reducing the processed food. I'm saying processed food because it's been shown time and time again, and I'm just back from a conference where they really spoke about, processed food being a big problem with inflammation, that we really have to start getting our diets healthy, reduce sugar in our diet, because that's totally influencing inflammation, and inflammation causes disease. So we've so much in our, and I say to patients, don't bring it in. We as women do the majority of the shopping once a week. Don't bring it in. Go out to the cafe twice a week and share a treat. Do you know what I mean? I really think that's where what we have to do. Because if it's there and we're all tired, which we do get after a long day, of course you're going to eat it. So I think that's where we have to love ourselves. But just going back to the T3, there are a certain percentage that just have to get it, and they do very well. But in some we're doing combinations, and that works, unless they absolutely can't take the T4 at all.
Yeah.
But the most important thing is you get their blood tests right, but you also get them to do everything else, and they do phenomenally well. They really do very, very well. Okay. And it's fantastic. And most patients, once I get them right, I might only have to see them once a year, or their GP can look after them, because it never goes off again. The only time their thyroid will go off again is if they get overtired, or if they got COVID or glandular fever, because of course that's going to affect their hormone control center, and it's going to put the thyroid out of sync. Or around menopause, if they're having a really bad menopause, of course that's going to put thyroid out of sync. But all of these things can be rectified, and everything can be brought back to normal. But with overactive thyroid, then the opposite. It's when you're losing weight, you're still very tired, you're agitated, you're irritable, you have palpitations, you have sweating. So the sweating is also associated with menopause, but the agitation and the profound weight loss is something so if you're losing loads of weight, you're irritable, you're really agitated, they're symptoms of an overactive thyroid. So easy to treat, and so easy to bring it back to normal. And the anxiety associated with an overactive thyroid is dreadful. And
it's awful.
It's absolutely terrible. I had a woman in last week, so anxious. It was horrendous. And I said to her, don't worry, we'll get this sorted. And honestly, within a few days, she rang me back and she said, I feel amazingly better. So that's really, really key. Okay. And I think sometimes we have to be careful in medications. Traditionally we always use the beta blocker. Yes. To bring down but the one thing, I had a patient referred to me recently, and she was on a massive dose of beta blocker. Of course, it was whacking her. It might have been stopping the conversion of the T4, but it was whacking her. So, the new treatment now, and what we do is just settle the thyroid. Don't be giving them a huge dose of beta blocker, because it's going to completely slow down their heart rate, and they're going to whack them even more. So we did that with her, and thankfully she did very well, and I just weaned down the beta blocker very quickly.
See, it is about titrating doses. Excellent. And not everyone is the same. And yes. Do you know what actually I say to people as well? Because sometimes people will miss their thyroid medication, they'll miss their Ultroxin. Yeah. And then, so they might miss it for a day or two, but it's only a week later that they start to feel the tiredness and the fatigue as a result of it.
Totally.
And they don't know where that comes from, because they took it that day and they don't realise. Yeah. So it's important for people that do have underactive thyroid to really try and take their Ultroxin every day.
And on their own first thing in the morning. That's so important. I had a patient yesterday who basically put it out because she was taking a calcium tablet with the Ultroxin and completely interfering with it, and a vitamin D. So it's really important. First thing in the morning, have it on the bedside. And then by the time you've washed your dress, is an hour past and you can eat away.
That's so very important. And even with tea and coffee, it can affect the absorption as well. So it's just, literally it should be the first thing that you take in the morning. And a lot of people would say to me as well, can I take it with other medication? I say, listen, just with your Ultroxin, just take it by itself. Obviously, if it means you're going to forget a heart tablet, you can take them together, but really try and make the Ultroxin the first thing that you take in the morning.
Absolutely. But if it's beside the bed, you can do it, and the rest can be done on the breakfast table. It's about sort of putting that time for yourself and having it done the night before. It takes seconds to do. Yeah. But you're so right. And it has to be taken more or less every time.
I want to talk to you about weight gain in menopause, because I get a huge amount of queries about that, about the belly that women get. So a woman going through her life, all her life, had an average weight, or was very happy with her weight, exercised well, ate well, and suddenly she hits 45, 50, and she has a belly that she literally cannot shift, no matter how much she exercises or how little she eats. Can you discuss that, and can we just put women's minds at ease about how natural that is, and about how sometimes we need to kind of accept that our body will change.
Absolutely. So again, perimenopause, this is when this happens, usually 45 to 50, anytime around then. What is perimenopause? It's when the eggs are becoming depleted. They're not depleted, but they're coming depleted. Most women now might be 47. So if some of you are trying to get pregnant, don't be alarmed, right? It could be 47, 48 when this happens. But when the eggs become depleted in the ovary, are starting to become depleted, your FSH hormone that's in the pituitary, which is controlling the egg formation, that's going up. And as that's going up, it's whacking the pituitary, right? What does that mean? It means that pituitary gets a little tired. Metabolism, therefore, is going to slow down, right? Your estrogen levels are a little low as well. That's all also going to slow down metabolism. So if you slow metabolism, then you just have to get clever about the diet. And this is the key. Before this, you would have got away with eating a chocolate bar every day. Now you can't. So what I always say to women is keep it simple. 3 healthy meals a day, 2 healthy snacks, and that's it. And try not to eat after 7, okay? Because your metabolism is actually fastest from 7 in the morning till 7 in the evening. After that, it slows down. So that's the ideal. And of course, you can go out one night a week. Life has to be lived, but it's all about managing it. And I find when women do that, plus when they recharge. Now remember, this is about looking at the whole picture. So as well as eating healthily, as well as, understanding what it is, they also have to recharge and get the energy level back up to 10 out of 10, because if your energy is at 3 out of 10, your metabolism is going to be on the ground. So it's about recharging, pacing, getting that pituitary gland back to normal by doing those simple steps, by eating healthily, and by saying, right, I'll only have share the treat twice a week as opposed to having the bar of chocolate every day. You're not going to get away with it because the metabolism is down. And once you do that, it's fine. And it's so important because that abdominal fat is deadly. I remember going to a lecture in Italy many years ago, and this fantastic lecture was showing us pictures of the adipocytes, which are fat cells, and the 6 inflammatory markers they produce. And he said, these are endocrine cells. They're not just fat, they're endocrine cells. they were dishing out these horrible inflammatory markers, which cause huge problems, not only diabetes. So it's so important as women that we get that fat down, because not only are we at risk of diabetes and at risk of heart disease, because those inflammatory markers lay down plaque, but also we feel awful. So it's all about sort of taking control of your life and saying, hang on here, I need to slow down, pace, eat healthily, as well as getting my perimenopause, menopause sorted out.
Is there something to do with the fat cells as well producing estrogen, or it's something to do with...
They produce bad estrogen, and you're so right, and that can cause cancer and put us at risk of cancer. So the abdominal fat is so bad, but it's all about, I have found I'm mad busy, as you know, just as busy you are, Laura, and how I keep my figure well is I just eat healthily. So I do what I tell people to do. I mean, my shopping trolley has no sweet things at all in it, but when the kids, on Saturdays we'll go out and have a treat. Do you know what I mean? So I think just simplify it for everyone, and take control of it at that stage. And that's the way you keep. Yes, of course, exercise. Try and do the exercise 30 minutes a day. But for busy women and busy men, it's hard to fit that in. How I do it, I have an exercise bike, and I hop up on it for 20-25 minutes in the evening. That's how I do it, because getting out to walk the roads, I might meet too many people, and I'm just exhausted
to be asking about their thyroid levels.
Exactly. So I'm not going to do that, but I'll hop up on the bike, and if I don't get to do it tonight, I'll do it tomorrow night.
Okay.
So I think it's and if you're too tired to do it, don't do it at all, and do it when the energy levels have come back up. So in other words, stop beating yourself about just say, I'm going to take control of this. I'm going to just recharge, listen to my body, build it back up, but really, really pull back. And then you can get back into your exercise routine when you're up to it. But getting up at 6 o'clock in the morning, which you see a lot of women doing when they're absolutely exhausted, you're achieving nothing there. You really just have to pull it back, let your energy levels come up, because that's going to help your metabolism, that's going to help you control your weight. And then you can go back and do your exercise routine. But do it, listen to your body. If you're dragging yourself out of bed at 6 o'clock, that's not a good thing.
No.
You just have to listen to your body and let that dictate it. And that's so important.
And is there, though, like, it is true that, the weight proportions itself differently as we age too.
Totally.
So you may not have the flat stomach that you had in your 20s.
Yeah.
Like, I mean, we probably need to accept that there will be a little bit of extra fat, but to try and keep it as low as we can. Is that basically
absolutely, totally. But again, by eating healthily and doing the exercise and toning and doing the Pilates or doing the, that really does help, because we don't realise that muscle, by building up muscle, that really does help.
Oh, it does.
Every time you do those resistant exercises, which are so important for bone and osteoporosis, you release a bit of growth hormone and it's burning fat. So no matter what you're doing, you'll be watching television and have those dumbbells in your arm.
Sure, I have the dumbbells just in the shed, and I bring them in. I try and do, but maybe about 4 times a week, a bit of resistance. And I do think that as we're getting older, and do you know what I think as well? And I think that the conversation is changing about exercise. It used to be very much about looking a certain way, but actually, don't we want to be old and able to tie our shoelaces, wipe our bottoms, and go and pick our groceries up ourselves, and not have our children dependent on it? And that's what weight-bearing exercises will do for us. And like what you said, it releases a bit of growth hormone. Insulin is metabolized as well. So there's so much to those weight-bearing exercises that is just so very important.
Yeah, and those fat cells around the tummy, they produce bad insulin, which makes fat. So, doing the exercise gets rid of that. But obviously losing the weight gets rid of it as well.
It's like a vicious cycle if you don't do it, and it's a positive circle if you do it.
So I think doing a little, not overdoing anything, but doing everything, the exercise in moderation, not excessively, because that's achieving nothing. Getting the energy levels back up to 10 out of 10, and then eating healthily as well, and just pulling back and really just looking at your whole life and saying, right, what works for me here, and if you can do a bit of yoga, I think it's great. I had a woman yesterday, acupuncture works for her. Whatever works for you to help you to de-stress, that's so important as well. Bringing down those cortisol levels, that's going to help the hormone control center as well, because high cortisol levels is not good. It's causing inflammation. That's not good. So de-stress in whatever way you can. And remember, you're human. And being human means that these things happen, and you just have to step back and say, right, how am I going to cope with this? And what boundaries am I going to put in today?
And there are people running on high cortisol levels all the time.
Yeah, which isn't good.
No.
It's so unhealthy. I mean, that's been shown to be linked to inflammation, causing cancer, causing all sorts of disease. So stress in everyone's life. There's none of us don't have stress, but it's how we cope with it. And coping with it means being rested. When you know yourself, when you're rested after a good night's sleep, you can cope. I often, something happens, I'll say, right, I'm going to sleep on it. And I actually have the ability to switch off and not even think about it. And I'm well able to cope with it the following morning. So I think, taking control in that way and saying, do you know what? I'll deal with that in the morning. Things like that really, really help. But we all have to learn how to cope with stress. And I'm a big believer as a mother that I have to teach my children how to cope with stress. And one of the ways I do that is that I do the rota. Because the rota, as I had to do as a child, it didn't matter what exam I had the following morning, I still had to do my jobs. But that empowered me, taught me how to, to cope with adversity a bit.
You're the only... So I have a rota at home for my lads too.
Good, yeah.
And whenever I tell people, they kind of laugh.
Yeah.
And they say to me, oh gosh, listen, it's as easy for me to do it because I just do be nagging them.
Yeah.
But I actually say to them, well, jokingly, I say, well, but starvation helps. So if you tell them they're not getting their dinner unless they do the jobs, that makes them work quicker, or take their devices off them.
Yeah.
It's give and take, and it's all
empowering
transactional.
them. And it's empowering them.
And the last thing I want is to be run under a bus tomorrow and my 3 children not to be able to fend for themselves.
Totally.
Because their dad's going to have to go out and work doubly hard if I'm not around. So do you know what I mean? It's just so important, isn't it?
And we were talking earlier, my husband died, unfortunately, when the twins were 8 and Una was 5. And if I hadn't have that rota, I don't know how I'd have coped, because my job is hectic. But, the rota meant everyone hands on deck. Even when Una was 5, she used to clean the table and sweep the floor. The boys did the dishwasher and hung out the clothes, and they all did their lunch. And as I always say to patients, when children make their lunch, obviously I was looking over it, but they were making it. They ate it. There was no lunch coming back, So there's a lot of little things. And I feel as a mother that empower them. It enables them as to be able to deal with adversity, which we all have to. And I know, talking to patients, they particularly mothers, they do too much for their children, particularly their adolescent children. And those children don't necessarily, it doesn't help them, but also they don't respect them for it. Appreciate it. So one thing I want as a mother is to be respected, but also I want them to be able to deal with adversity. And I want them to be able to hold their own. And that's how you do it, and you start at a young age. And I think it's very, very important. It really is. It was done to us as children. We were all made do our stuff.
Oh yeah.
I think it's really important that
and if
we
they
do
cook
it to
a
our
little
children.
plate of pasta for themselves when you're not home. It's so very easy.
Great.
And you can teach children to make sandwiches for themselves from a very young age. Like my kids were emptying the dishwasher from the age of about, like, when they could start walking, just to show them how to do it. And just, it's about those everyday little routines that they get used to.
And remember, you're too tired to be arguing with them and shouting them. The rota just takes care of all that. It just, you follow it, and then I had everything I could put on the rota, everything. And then, that just meant they did it. They were delighted to do it. It gave them a sense of satisfaction as well, that they were contributing. And it just all worked well, even to weeding, deadheading the roses. You've all seen my garden up on Instagram, but like, the kids are great as well. They help out. So it's given them a love of all that as well, which I inherited from my mother, do you know? So it's wonderful.
Mary, you touched on your husband dying, so I can't brush over that. And so can you just tell me a little bit about that? Because your children were very young. You were a busy lady. It came out of the blue. How did you cope?
It was very difficult. And I say to all my patients, when somebody dies, it takes you 2 years. You go into a bit of a hole for 2 years. And I'll always remember my father, who meant it in a lovely way. He said, Mary, after 3 months after Eamon had passed, he said, Mary, you're going to have to pull out of this. He said, you've only one life. And he did it out of the goodness of a father. But in actual fact, you can't understand what it's like unless you're in it yourself. You just go into this dark hole. You wonder, if it wasn't for the children, you'd say, because I was very young at that time, and you're sort of thinking, oh my God, there's all my dreams shattered, because we'd only moved into the house that our dream home, and did it up a lovely period house. And so it was all sort of, oh my God, is this it for me? Those sort of questions. But because I had the 3, and thankfully my patients were amazing. Every one of them come in, how are you doing? No matter how unwell they were. So, with support of family, children and patients, I got through it. But that doesn't say it was very difficult. And one of the other ways I got through it was we went for regular holidays, and they were great bonding sessions. I needed to get out of the house. Every, week that I'd off, I took the kids and we went off, and we went out of the country, and it did me the power of good. And I often thought people would say, where the hell is she going? And I didn't care, because that I needed it. So I followed my gut, which I do a lot, and I did what I knew I needed to do. And those were because the children were traumatized as well, of course, because they had lost their dad. So those little bonding sessions where we were over in Lanzarote on our own, it was lovely, and it got us through. And we did that, I think, 4 times a year. We just had to. But then all the other times we were very, we were a very close family anyway. But the cousins, the double first cousins, were terrific as well. And just the family were great, friends were great. But I think I accepted the help of people as well. I think a lot of people don't do that. I accepted the help. I took the help if people offered it. But, thankfully, I suppose I have a great inner strength as well, and I just do get on with things. But that's not to say that, of course, I cried, and of course I felt really tearful, and of course I wondered, what's it all about? Naturally, I was fierce angry. And you do go into that 2 years of that you go through all the cycles of grief. You go through the disbelief, you go through the anger, you go through the resentment, you go through all of it, but you eventually do come out the other end. But it does take 2 years. And I always say that to patients. I thought once I had the first Christmas over, I was going to do okay. The second Christmas was way tougher. But it's all about, like menopause, it's about knowing. And I always tell all my patients now,
listen, look at you bringing it back to menopause. Any opportunity.
No, but you see, if you know you can deal with it.
You're a pro.
So absolutely. But every patient that comes into me that deals with the death, I'd always say, look, just to tell you, I went through it, and the second Christmas was harder. So I'm just telling you that so you'll be prepared for it. And they've all come back and said, you're so right. So, I do think forearmed, forewarned,
Yeah.
I think that's really important. But we're all human, and, you get through it. Everyone gets through. Look at the terrible tragedies that have happened in the last few weeks on our roads. Oh God, I couldn't deal with that at all. But you get through it with the help of everyone. You have to dig deep, and thank God my little kids are amazing.
It's so funny, actually, I have to tell you. So when Mary and I first met, she talks with her little children, okay? so she did this talk, and she's talking about my little boys and my little girl. And then I met the little boys at her book launch. By the way, Mary has a book out, and we're going to discuss that later on. I met her little boys, who are bloody well 6 foot,
6'4" and 6 foot.
And they're absolutely, they are great lads. Like they
Thank
have,
you.
but to rear your children by yourself, like, I mean, that must have been tough.
It was very tough. It was very tough. We're very close, and as I said, they pulled their weight. I have a double first cousin, Joseph Ryan, if he's listening, up the road. Two sisters married two brothers, so double first cousins. We came up.
I didn't know what that meant. Actually, I was going to ask you. Okay.
Mammy and her sister married two brothers. That's okay. And so we're very close. So they were great help. My own family, terrific. My parents are fantastic. So I suppose just all that camaraderie was essential. But of course it was tough, and of course it was tough days, Laura, but we thank God we came through it. But the kids have turned out great. But I think it's because, I think I said this in the book, that I read a book at the time I read loads of books, because you look out for help when you're going through a tough time, as we all do. And I read a book by Dr. Tony Humphries, a psychologist. I went and heard him, and he's brilliant. I love him. But he wrote a book called Self-esteem for Children. And that really gives you great guidance as a parent. And I think I use that. So I sort of have boundaries with the children. They knew I loved them to bits, but they knew that to pull their weight. They knew I wasn't going to take any back answers, because I'm a big believer in respect. I've often had patients come in, and a mother would bring a son in who's had a hormonal problem, and while she was talking and trying to explain about her 17-year-old son or 18-year-old son, he'd take the head off her, and I'd say, listen here, I'm not going to take that. And I would never take that off my kids, because I really think respect is so important, because, if you have respect for each other, we'll never abuse anyone. And I just think that we have to do that from a young age. So I brought them up with that. And, thank God they've turned out great. So I'm blessed. I'm blessed. Yeah. So that's good. Yeah.
You did try and slip in the menopause thing there. So I'm going to bring it up again. With all the menopause talk, HRT has had a resurgence. Yeah. Now, I worked in pharmacy for 20 years before I left last year, and I was there during the time where HRT was pretty much demonized. It was because of the scary stories and the report that had come out about breast cancer and that. And now there has been a resurgence of HRT to the point that it's almost like everyone should be on it as a preventative for the symptoms. Like I had, when there was an RTE program there released, I think a few months ago, and they were talking about HRT, I had friends who rang me up who were, they're in their early 40s or late 30s, and they said, oh my goodness, like I want to go on this to prevent all these horrible symptoms happening. And I have spoken to doctors who feel that patients come in and they almost demand HRT. Yeah. And it's, the doctors are saying, well, there isn't the long-term evidence for, long-term use of HRT. People think that they should be prescribed more than they actually should. Can we discuss a little bit about that? Because obviously you, being an endocrinologist, would have prescribed HRT over the years, and I'm sure you've seen a difference in what people are expecting when they come in and sit in front of you.
Totally. So there's a few things I'd love to bring up there. First of all is what's lovely about menopause, and having started our own conversation, it's terrific. We're now listening to and talking about it, right? The downside, unfortunately, is there was some misinformation come out, which was so unfortunate, but that'll always happen. So HRT is a wonderful drug to have, because there are some women that really, really suffer. So if you look at the average, there'll be 3 or 4 women that'll sail through menopause. That's if you take good 10 women, 3 or 4 will sail through menopause. They won't even know they had it, which is absolutely wonderful. You'll have another 3 who will have a few aches and pains, have a few night sweats, have a few flushes. With lifestyle change, with taking something natural, they will do very well. With taking their vitamin D for their bones, doing their resistance exercises, they'll do very well. And pulling back and making the lifestyle change, they'll do really well. And then you'll have another 4 that will absolutely fry. And if they didn't have HRT, they'd be absolutely lost. So they're women that sweating and flushing all the time, absolutely desperately anxious, terrible vaginal dryness, intimacy is impossible. So HRT is a must for them, right? So that's your broad range. And I suppose in talking about menopause, wanted always to get that across. It was just a pity that, this message went out that HRT is for everyone, because it's not. And thankfully I have patients coming in and they say, Dr. I don't want it, because they're well educated and well versed. But it's a great thing, and I don't want there to be a negative against HRT, because it's so necessary for some women, but it's not for every woman. And I think the big thing is that the long term, and we have as doctors to go with long term evidence, and the long term evidence says, be on it for 3 years, the minimal amount time possible from a safety point of view. So that's 3 to 5 years. So the whole thing is not putting women on it before they need it, and then leave them on for 3 to 5 years. We can leave them on till 60, but if they're doing fine, you can wean it off after 3 to 5 years. Now, there's an awful lot of social media are saying, oh, stay on it forever. But as doctors, we always have to come back to evidence-based medicine, and pharmacists as well, Laura. So in that case, I would have most women after 3 to 5 years, they'd actually be saying, I'm feeling great, it's okay if I wean this down. I'd say yes, see how we get on. If they don't, we'll put it back to 60. The majority will come off it at 60, because that's what the evidence-based medicine says we have to, because otherwise we increase the risk of heart disease. It's protective before that, but after 60, you increase the risk of heart disease. So we have to stop it. There's been a few patients I tried to stop and couldn't stop it. And then what I do is I have to watch their heart and just do heart scans on a regular basis and keep an eye on them. But that's the honest truth about menopause and HRT. So I'm trying to get around the country, saying that, because that is the reality.
There is talk online as well, and I think they're talking like menopause is estrogen deficiency, like as if it's some kind of a disease, when in actual fact, like, it is a natural process. And I think that we really have to acknowledge that. Totally. Because if we talk about it as a deficiency, it's talking about like as if it's something wrong.
Oh, totally. Yeah. Melanie Morris rang me up, and you did a podcast with Melanie, and Melanie rang me up and she said to me, Mary, would you ever try and get a positive message out of menopause? The way it's going, she said, none of these menopause women will be employable. That's the sort of negative connotation they're putting on it. And she was right, because it's our second spring. We should all have another 50 years after menopause. And yes, some women really suffer, and it's so important we got the message out of all the symptoms so women knew what they were dealing with. But we're arming the information, but then we're also arming them that some of you won't need only to make lifestyle changes, healthy eating. We have to reduce the confectionaries, and you won't get away with all the bars of chocolate you got away with before. And then the others, natural, taking something like clean marine minimum, the fabÜ that you're doing, which is going a treat. And that's absolutely wonderful. And then others will need HRT. And yes, your vitamin D and your magnesium, vitamin D for the bone, magnesium great for relaxing muscles and helping sleep and helping bowel, because good laxative effect with it as well, because some women get constipated around this time with all the hormone imbalance. So it's about giving women the correct information and not the negative. But the positive has to be that these women are now going to go on for another 50 years, and obviously look after their heart health, their bone health as well, because around menopause, your cholesterol, if you have the genetic defect and you have that LDL receptor defect inherited from either parents, your LDL will go up, which is the bad cholesterol, okay? And if that goes up above a certain amount, you're going to get heart disease or stroke. So some women do have to go on medication. Watching the weight, like we spoke about before, so important. And then watching the blood pressure, because the arteries are going to become a little stiffer. So some women get blood pressure. And the big thing is that women suffer more from heart disease than cancer, particularly after menopause. So just to make sure that you know the symptoms: tiredness, shortness of breath. Not everybody gets chest pain on exertion. Just to be aware of that.
Okay, and restless legs is
it's desperate. It's desperate. So that's all the peripheral nerve stuff. You remember I told you that the hormones are coming down this little peripheral nerve to all the muscles. And remember, the feet and the legs are this far away from the pituitary gland. So that's why the legs get affected most. The pituitary is tired, FSH is going up, and those legs are going to get very restless. Magnesium is great. Magnesium is great. Resting, pacing is great. And then sometimes you do need a drug like mirapexin or amitriptyline or Rontin for it. It all depends how bad it is. But this one, I remember when I was on Joe Duffy, a woman rang in and she said, I have a creepy crawly sensation on my face. And of course, that's classical peripheral nerve, except that was the nerve that was being irritated. But she felt that she thought people actually thought she was going mad, and this is the awful thing, that this wasn't put out, that though these poor women over generations, I actually came across women who told me that their mother was put into an institution around this time.
I've heard
and that's
this.
So sad,
And it's happened. People in a lot of families that can relate to that. Women have been put into psychiatric care because
desperate
of menopause.
Exactly. And I've seen that anxiety. I've seen those women come into me so anxious, completely normal. Husbands are with them and they say, gee, the anxiety level is off the charts, or the peripheral nerve thing is off the charts. Or I had one woman who her tongue was burning. She was a really a high hitter in financial wise, but she couldn't. The tongue was absolutely off, and she was told it was in her head. She was completely fobbed off, but that was peripheral nerve. But tongue is a muscle supplied by peripheral nerve, and once we treated it, and she always rings me and says, "I wouldn't be where I am today only that I met you." And we actually met at a women's event. It was so funny, and she was just telling me about this burning tongue, and I said, "I'll sort that out."
And how did you sort it out? Tell me.
So in her case, she was flying around doing everything, not adhering to what I've told you. So I had to say to her, to get the pituitary gland right, you have to eat healthily, which she wasn't doing. You have to pace. You can't be flying around the way you are. But we actually gave her low dose amitriptyline. It worked great.
Okay.
Yeah, hers was so severe, magnesium was never going to work.
Yeah.
She needed either the low dose amitriptyline, which, as you know, works on peripheral nerves. It's not
yes,
an antidepressant at a low dose, and never was an antidepressant at 300 milligrams anyway to any zonked patients. But at the baby dose, it's fantastic for peripheral nerve, because all it's doing is stopping the hormone being broken down at the nerve muscle junction and settles that restless leg. It's brilliant. But no point doing that if she doesn't do everything else as well. So I think the holistic approach is very important in medicine, that we do everything as well as the medical part, because that's helping the whole hormonal system, the pituitary gland, and all the little messengers. They can only work at their optimum if the body is functioning as a unit and really at 9 and 10% out of energy. And I didn't talk about fertility, but that is so important in fertility, that women are well recharged if they're trying to get pregnant. I had a woman in yesterday and she's dying to get pregnant. Her energy levels on the ground. I said, don't even try. Wait until, let's get the hormones right. Let's get your energy back up to normal, and then you'll get pregnant, and that's a big factor. And the other factor I'm going to bring out is that what's very, very important is that we're honest with patients. I had a patient who was in, and she came in and she'd been through 2 rounds of IVF. When I questioned her, she actually had ICSI. And
tell us what ICSI is.
Okay, so ICSI is where you inject the sperm into the egg, okay, and then you get an embryo and you plant it into the womb. And it's great to have it, because sometimes sperm aren't swimmers, and it's a wonderful thing to have. So we're not downing this at all. But I've had a good few women into me that basically were never told that their husband's sperm were the problem. They were told they were the problem. And this particular woman had gone through 2 rounds of IVF and had been told she was the problem. In actual fact, everything with her was perfect. And when she came out and said ICSI, I said, you do know ICSI is because his sperm aren't right. I said, do you have his sperm? And of course she had it on the phone, showed it to me. And they were totally non-progressing, and she was never told. And I think we have to call that out. It's very wrong that women, it's okay to tell women that they're the problem, but it's not okay to tell men. And I've seen that time and time again. So I'm going to call it out here, Laura, if I can.
Absolutely.
So it's just important. It doesn't matter which of us is the problem. All we want is to get a little miracle baby at the end of the day. But it means a lot if you're misinformed. And this woman started crying when I said to her, this was his sperm, but listen, at least we know this is the problem. But they should be told.
Absolutely.
And that's something, again, as a chauvinistic style of, macho thing. We need to stop that. It's not fair to men or women, because both of them want a little baby,
Yeah.
And that's really important. But with fertility, it's so important that women do make sure that they're well recharged before they try to get pregnant. In a lot of cases, they will get pregnant if they do that. Then if there's some issue, then of course that can be addressed. And polycystic ovaries is really underdiagnosed. This is where the cysts on the ovaries, you can often start off actually with a very regular cycle from puberty, but then the FSH level will go out of sync. Then you get your cysts on the ovaries, and those cysts produce bad insulin, which makes it difficult to lose weight. And also the excess estrogen converts to testosterone, which is the male hormone, and that's why you can get the acne and the excess hair. Not every woman gets both. Some might just have the irregular periods and the weight. They mightn't have the acne and the excess hair. But the important thing is that the way you treat it is you get the weight down to normal. You really have to, because of a slower metabolism, everything I said earlier applies. They really have to eat really healthily.
Can't it be very difficult for them to lose the weight, though?
Very. And we give them metformin.
How do we help them?
We give them metformin, which is a drug that we use in diabetes. But how it works is that it knocks off the bad insulin. So if you knock off the bad insulin, you really help them to lose weight with eating healthily. So it's about empowering with the knowledge, and they do phenomenally well. But I'd like to see them diagnosed more. And as you know, in my book, Laura, I did say that we need to be earlier at addressing heavy periods, because we're preventing problems down the road. We need to be going in there when children are in their teens, and even with PCOS, getting in there early. I don't want to be seeing patients coming in their 30s. They should have been caught 20 years ago. So I think that's education is very important.
Well, it absolutely is. And can we just talk a little bit about period length and cycle with you, please? Because what I find really interesting when I first heard you speak was that periods should only last a certain amount of time. And if they're lasting longer, little girls, teenagers need to be taken to their GP or a doctor just to have it themselves checked out.
Absolutely, yeah. So a period should only be 3 to 4 days. In fact, the majority, as you know, are heavy for a day, and then it's just a little show for 2 days. But some 3 to 4 days is fine. But once it goes on beyond that, I mean, I have so many women that come in and they say I've had 7-day periods from the age of 12 and everything was perfect until I had my period. And I'm talking 7-day very heavy periods. Now that's completely abnormal. And those women, because that FSH hormone is overdoing it, they're going to have cysts on the ovaries, they're going to have fibroids, because what does FSH do? That hormone that it pushes the eggs and pushes the lining of the womb, that basically is hitting all estrogen receptors in the breast, in the womb, in the ovaries. So that those women that have real heavy periods could have cysts on their breasts, which worries them, and they're going having, ultrasounds on the breast. They can have cysts on the ovaries as well, cause fibroids in the womb, which are these big fluid-like cysts that can eventually press on the bowel and cause bladder and bowel problems, and cause problems, because they have to resect it, and then you have scar tissue in the womb that might cause problem with the pregnancy in the future. So there's so much by focusing on this, by educating schools, parents on what's normal, and then if it's above a certain length, take your child to the GP, get that sorted. It might be just taking progesterone for a little part of the cycle just to push the FSH back to normal. Often cases that's all that's necessary, but get it sorted. I love the way
you talk about it, like just push the FSH back. It's all about tweaking things,
absolutely, and getting it normal. And don't have that, because I get those women coming in the 30s and they're absolutely fried. Of course they're fried. 7-day periods, really heavy, a whole week out of every month of their life since 12. They've had this, so of course their pituitary is going to be wrecked. So it has knock-on effects as a result. So it's about getting it in time and parents knowing and treating it. That's so important.
And the oral contraceptive pill, taken from a young age, what are your thoughts on that? If it's supposed to, for irregular cycles, etc.
Yeah. Sometimes we have to use it, but the big thing, and this is where research in women's health hasn't been done, and it needs to be done. There's been no research done on how long is it safe to take the pill. When you think that girls are being sexualized very young, and a lot of them are on the pill at 15 just for contraception, some of them could be on it until their late 30s, and that research hasn't been done, and we need to do it. So that annoys me as well when I see that, and I've called that out several times. But yeah, the contraceptive pill sometimes is necessary. I love people to use the progesterone first, because sometimes the progesterone in the latter part cycle really does work, and you don't need to go to the pill, but for correcting the period. But if you do need to use the pill, then that's fine. But you see, the big problem is that the long time girls are on contraception because they might be with a partner, and don't want to get pregnant, and that's something needs to be looked into more. We've loads of options, but sometimes the options are not. Some of the contraceptives can put on weight, for example. So we need to look into that and look on how long is it safe for our little girls to be on the pill. For example, I would have patients coming in and they might be on the pill 10 years with no break. And sometimes the pituitary doesn't kick back for ages, if at all. So they do need to take the break. But there's no education out about taking a break. I'd say to women, take a break every 3 years at least. Come off it for a month. Don't get pregnant in that month, obviously. But these are things that are just taken for granted and never spoken about. And that's wrong.
You'd have a lot of ladies as well that they may have been on the pill for, say, from 17, 18 for their entire 20s. And it's only when they go to have a baby that they realise they actually have a libido.
Yeah.
They've lived their whole 20s without their libido, because it kind of dampens down those hormones too. So this is absolutely not a negative on the contraceptive pill. It has been amazing for women's empowerment.
Yeah.
They're not getting pregnant when they don't want to be. But it's worthwhile considering all kinds of options. Isn't that right?
Totally,
that's why we're here today.
Totally, yeah. I think so, and I suppose I'd love more research on how safe long term is for girls, and let's do all sorts of research. Is there anything we do for men? I know women always say to me, listen, at least if I take it, I know.
You'd never trust a man who says, trust me, I'm on the pill.
Exactly, but it's just I think more research needs to go into the area. As I said, it's wonderful. It does all sorts of things. The contraception we use it sometimes for controlling periods, yes, but I just love that long term data. I do worry sometimes with people being on the pill for 20, 30 years, how safe is that long term? Okay. I think we've got to start asking those questions, and those need to be answered. And again, it's women, putting their lives, always putting their hand up. If we're empowering women, those questions have to be addressed.
Yeah, absolutely. Can I talk to you a little bit about depression?
Yeah, of course. And
how much of that you see in your practice? Because, I think that sometimes depression, there's an over prescribing of antidepressants, when in actual fact it's, and I think the people in the face listening to us today now, it's about getting to the heart of the issue as well. Antidepressants can be absolutely wonderful and transformative for many people. Yeah. But there would have been a lot of ladies that maybe put on antidepressants because they have menopausal symptoms. Yeah. And it may not necessarily be the antidepressant that they need. Totally. Yeah, I would have seen women, for example, that came into me absolutely exhausted because they're not sleeping. I mean, the big thing in menopause, perimenopause, people not sleeping. If any of us aren't sleeping, your pituitary is going to be wrecked. You're going to have the, absolute exhaustion. And of course, you're going to feel exhausted, tired, irritable, whatever. I was very, very lucky to be educated. I said this in the book, educated by Professor Anthony Clare. He was an amazing psychiatrist, way ahead of his time. And he always talked about endogenous depression, which is real depression, where if somebody is really depressed, and this is a genuine illness where they just can't get out of the seat, they have no insight into it, they just don't want. But the other reactive one is hormone imbalance. It's where the pituitary is tired and where we're just exhausted because of not sleeping, because overdoing it, and as a result of that, then you just energy levels are 2 out of 10, aches and pains all over the place, no energy, no libido, no nothing. That's reactive, that's pituitary exhausted, and that you don't need antidepressants for that. You just need to be told this is what it is. You've got to treat whatever is the ensuing cause. If it is menopause, not sleeping, whatever, deal with that. If it's anxiety, deal with it. It's very simple to deal with that. But you definitely, some patients, just giving them a bit of magnesium or a bit of melatonin and getting them to sleep can really do well. Or your fabÜ relax. Some patients told me they found it brilliant as well. So, it's about listening to them, diagnosing it correctly, reassuring them that there's nothing else wrong. Because remember, that's all people think, when they get wrecked, oh God, what's going on? I'm in a black hole. But it might just be that the pituitary is wrecked, that the hormones are all over the place for all sorts of reasons. You deal with that, and in a natural way, you can get them back to normal in no time. And I see it all the time. HRT help with the sleeping issues as well?
Absolutely, yeah. So those women that get very anxious, HRT works a dream. Yeah. It really does. Those women that trouble flushing and sweating all night, of course it does. Yeah, absolutely. But I was saying for the women even younger that might be coming into me where they're just overdoing it, the teacher going from 6 till 11, they'll do very well by just pulling them back, reassuring them that everything else is okay, because they're always worried that something else is going wrong. Give them a good examination, making sure you've checked them on completely, and then saying, look, this is what's wrong, and drawing the diagram, and then saying you've got to diet, because sugar causes terminal inflammation. Pituitary hates it, so you've got to get the diet right, get rid of the processed food, just have a minimal amount, resting, recharging, and then, taking something to help them get back to normal, and get a good night's sleep. Yeah. So it's about diagnosing it properly and then armoring the patient with the information, and they then go on and do it. But once the patient understands that you've completely listened to them, examine them, and that this is the diagnosis, they were going to do it. Whereas if they're thinking, oh my God, that's not it, they're going to keep looking. Yeah, that's really important.
So it's about reassuring them
and making sure, really making them understand this is it. And once they do, they'll go off and do what you tell them, and they'll get better. And that's the key thing. But yes, depression is overdiagnosed, and that's one of the things that brought me out actually talking about menopause. Well, I was fed up of women being fobbed off and told they're depressed, when in actual fact they were, women in general, we're doers, we mind the children, we manage the house, we do everything. So when a woman's coming to you and she's absolutely exhausted, it's an absolute insult to be told you're depressed, and women used to come into me crying saying, look, if you're going to tell me I'm depressed, I'm walking. And of course I wouldn't be going, I'd be the one that wouldn't say that. But I want to highlight as well that there are people that genuinely do suffer from depression, and there's great treatments for them, as we know. But the hormone imbalance that ensues around women being overtired in particular, be it through heavy periods, be it through perimenopause, menopause, be it through, that's so treatable, and it doesn't need antidepressants. That's really important.
I'd love to touch a little bit upon diabetes. Now there's type 1 and there's type 2.
Yeah.
We're seeing an increase in type 2.
Yeah.
Are we seeing an increase in type 1 as well? Is there an increase in it? Or
do we haven't done the data yet to see the slight increase. COVID, would you believe, did damage the pancreas and caused a bit of type 1, but we haven't the data out how much of the increase, but very, very slight. As type 2 has gone off the Richter scale, type 1 a little bit, and we believe some of the viruses attack we don't know which, but we've seen a few after COVID.
Okay. Yeah. So can we talk a little bit of type 2? Because
of course.
I was reading something somewhere and it said if you actually screened everyone for type 2 diabetes or pre-diabetes, there'd be a huge amount of them.
Yes, totally.
And why are we seeing the increase?
So the type 2 diabetes is majority of cases down to overweight and obesity. So once you put on weight, particularly abdominal fat, the fat cells there, as I said earlier, are very, very metabolically active. They produce 6 hormones, and they will cause inflammation of the pancreas. And once you damage the islet cells in the pancreas, you will damage the insulin producing cells. And insulin is a hormone we all absolutely need. It's one of those ones we die without, because insulin brings glucose into your muscles. Without it, your muscles can't function. So where in type 2 diabetes, what happens is that with the abdominal fat, you get big insulin resistance, and then you damage the pancreas, but you also produce bad insulin, and the bad insulin can't bring the glucose into the cells. So that's why there's loaded glucose then in the blood, drawing this osmosis effect of pulling water out of the muscles, and that's why you're so dehydrated, and that's why you're going to the toilet a lot. So the symptoms are very thirsty, going to the toilet a lot, and also being very, very tired. And it's because the insulin isn't working right, or there's not enough of insulin, and it can't bring the glucose into the cells. So if we get the weight right, we must keep our weight right. I was in Amsterdam recently at a conference. There was very little obesity there. They were all on their bikes. Okay. Now I know in Ireland we don't have the weather they have in Amsterdam, but we really can do so much by just eating healthily and starting with the trolley. As I said earlier, we all do need to exercise. And I think this thing of, having a stop off, I think that's so important. Not eating after 7. I myself find that when you're really tired, you start nibbling and grazing. I remember a dietitian doing a study, and it was frightening how much people graze and how much calories they take in.
We're just opening the fridge and taking a slice of cheese and not even realising
and she showed me that some people, she did a great study where she showed by grazing people can just do 1,200 calories and not even realise it. So, I think that's where you have to have a stop off. You say, right, I'm finished at 7 and that's it.
But isn't it difficult though with modern life, Mary? And for, women and men, but women in particular, they're working hard. Yeah. They might be minding a few kids. They're maybe collecting for the crash or the childminders, coming home, having to put food on the table for the children. By the time they sit down themselves, it might be 9 o'clock. And then the easiest thing to go for is a carbohydrate loaded snack or something like that that doesn't fill them up. So, and I think that as a society, we have huge issues with it, and the food industry has a lot to answer for too.
But I think we need to simplify it, and the way we simplify it is bring in healthy food, stop bringing in the processed food. Some of those orange juices are so full of sugar, just keep it simple. It's much easier. Get that rota going, get everyone on board, not just the woman. We've got to stop putting our hand up all the time. We've to let everyone see we're equal and make sure that the whole family is pulling their weight, and share the load, the taxi load. You know, if you're going out to take your son to football match night, your husband will take the following night. You don't have to go every night, you know, and that's really important. And I'm not down on men here, you know, I'm just saying that equally, if they were overtired, we love men, exactly. So if they were tired, and I always say to parents as well, try and let one of you have a lie-in on Saturday and one on a Sunday. You know, just the two of you don't have to be on the sideline shouting for the child bar it's a final. You know, you have to be, because you're no good to the child if you're exhausted, irritable and shouting. So it's about, you know, taking a step back and saying, right, what have I to do for me to keep myself healthy? And that's the key. But eating healthily, you do have to make a healthy choice, and that's how you do it. And remember, if you do it, your family has to do it as well. Now, yeah, if you come in after doing a training session or being out at the side of a pitch, you will feel peckish. You know, that's where you have your piece of fruit. That's where you have your healthy snack. But you don't go for your real chocolate bar or your hot chocolate drink, you know, that sort of way. So it's about doing that. And I think as well as that, you know, the slow cooker we don't use enough. In you know, put it on, have it pre-prepared the night before, and then it comes on at 2:00 in the day. You have to think outside the box when you're busy. But it's possible to do it. There's always a way. It's just we have to stop making excuses and just do it, you know, but stop torturing ourselves, because we've only one life. If you get overtired, that hormone control center controls the immune system, and we don't want cancer. And there's way too much cancer, you know. I deviated a bit from diabetes, and I want to just finish on this, and I'm sorry. So type 2 diabetes, yes, it's gone up exponentially all over Western Europe, not just Ireland. But it starts with us eating healthily, teaching our children to eat healthily, and not having it there, so that, you know, if you have to go out for it, it's less difficult. So realizing we're human, right? And then the other thing is getting the exercise in, and by keeping our weight normal, you were avoiding type 2, because once you get diabetes, it's impossible to reverse it. The 800 calorie diet to reverse diabetes, you can't sustain that. I couldn't sustain an 800 calorie. I wouldn't ask anybody else to do it.
So you can reverse it on an 800 calorie diet,
but sure, who can stay on an 800 calorie? I couldn't, you know,
and
I love my food.
800 calories for life.
Yes, exactly. Okay. You couldn't do that. It's not possible. So, you know, once you have it for life. So it's really, really important that you try and avoid it in the first place. Now, if you do get it, the lovely thing is we have such great treatments now that we can keep everyone healthy. You know, it's all about, as I say to my patients, I want your fasting blood sugar at 6. That's where all of us should be, and our before supper should be 8. So if you keep your blood sugars normal, even if you have diabetes, then you're not going to get the complications of diabetes, which are eye disease, kidney disease, heart disease, and nerve damage. It's all about keeping it normal. And I always simplify too by saying to a patient, I don't want to hear about diabetic diet. It's healthy eating. You know, we're not going to put you in a box. The whole family are in it together. It's healthy eating. This is what we all should be eating. Everyone should be eating healthy eating. A diabetic diet is a healthy diet. So it's 3 meals a day, 2 healthy snacks. And yes, of course they can have shared their 2 treats a week, you know, but that's what everyone else should be doing as well.
There's a huge amount of talk about the anti-obesity medications that are right now. The Saxendas, the Wegovys, the Ozempic's gone short. All the celebs apparently. And this is, you know, allegedly are you know, injected. You know, I even get messages myself saying, you know, I've 2 stone to lose. I'd love to just take this just to kind of get me over home. What are your thoughts on that?
I'm quite cross about that, you know, because I have those patients coming into me. Now, Ireland is such a small country. We've so few celebs, bar you, Laura, and a few others, right? But you know what I mean? It just annoys me. I think the government needs to realise we're educated and we're not going to be fobbed off. That really annoys me. I have some patients who are very morbidly obese, and God love them for a whole load of different reasons, hormonal as well. They're obese, and they need something to get them off, to get the weight off, to get them on the curve. And these drugs work very well, and it annoys the life out of me that those patients have diabetes, and thank God we've the Saxenda for the ones that don't. But it annoys me. Saxenda now is even in short supply. And it annoys me because these patients deserve treatment, and I don't think the government can see the long-term view. If you reduce weight and reduce the risk of diabetes, I've seen the curves. I'm educating the medical students. You're cutting the economic risk, you know, cost hugely the cost of stenting, the cost of cardiovascular complications these patients get, the cost of kidney, dialysis, by getting the blood sugars normal and by getting the weight off the patients. So not having it in stock is dreadful, and I think the government should do a lot more to be having these drugs available. Just like HRT wasn't available there when more women wanted it, it should be available. This is something that helps women that need it. In the same way here, these patients are obese or overweight. They have to get the weight off because it's going to cause all sorts of problems, joint problems, makes them feel very unwell, low self-esteem, as well as all the heart and obesity and everything. And these drugs work. They're terrific. There was other drugs out that didn't even come near. These are brilliant. So don't, I hate when I get the call from the chemist who says, look, do you mind, doctor, I never used this drug, and I won't even mention it, but it was useless, right? That's why we weren't using it. So,
Go on, tell us what it was.
Yeah, no.
I know what it is.
So I say, no, I'm not, we're going to get it, and that's it. Because if it takes off, she mightn't get it back again. She'll be knocked off. So no, I said, no, we'll get it. And, but I just dislike the way it's been attended to. I just feel that people think that these patients, it's in their head that they're eating too much. Obesity is a very complex thing. Yeah. It's hormonal. Yes, there's emotional eating. There's a load of very complex issues going on, but they deserve help, and the help is there, and they need to get it. And those drugs should be available, and those drugs will get them. And I've seen these patients come in and they've lost all their weight and they feel so good, and they're putting their arms around me and saying, I feel great. And in the cases of where there's diabetes, their control is fantastic. I'm knocking off loads of diabetic medications. It's brilliant. In the patients just obese and they're on the Saxenda thing, they do so well. Yeah. So I just think that we need to revisit this and look at our approach and say, do you know what, we need to look as a European thing. And now we're in Europe, get the commissioners to up the produce. Why is it in short supply? If it's working, it's working. Cost, let's do a cost analysis.
Oh my goodness, if they just did that. Yeah. There is health economists that are doing that.
Yeah, but they're not coming out with it. No. And all they're doing is saying it's not available. This has gone on for 2 years. Yeah. Why haven't they sorted it out at this stage?
No,
but
crazy.
They would have prevented loads of complications by losing it. And people are being shamed. I have patients coming in and they're saying, oh, my chemist is saying, do I really need it? And they're thinking, that's horrendous.
And also, us in defense of pharmacists, okay, yeah. we got a letter from the HSE saying you are not allowed to give this out, more or less, unless the patient is diabetic.
Yeah.
And then, unfortunately, then someone might, encounter a pharmacist or a technician and they're nearly being asked, why do you need this? Do you have diabetes? At a counter where there's no privacy, and they feel like they're shamed. Like, I have GPs talking to me about this too.
It's very tough.
It is very difficult.
We're all in it together. We're not giving out about anyone at all. But I just do think the government in Europe need to really up the produce. This is a drug that works. It's been shown to be safe. And these patients, diabetes and obesity, they deserve to get the best help there is. And this is great. And if we can avoid, surgery, gastric bypass, if it can prevent complications down the road, why not? And I think this needs to be addressed. I really do.
No, I would 100% agree. I'm trying to look through any of the other questions that kind of come in, because there was so many. But Instagram has feckin' changed its settings now, and I can't find them. They all, I think we covered an awful lot of the main topics.
Absolutely.
I'd love to talk a little bit about your book now.
Yeah.
Let's give it a little bit of a plug, Mary, because it is a brilliant book.
Thank you.
Do you know what? It is an amazing book that takes a woman throughout her whole life span. I think it's a book that should be in schools.
Yes.
Because it talks to young girls.
Yes.
And it talks to older women too.
Yeah, it does.
And it brings you from your puberty all the way through to post-menopause.
Yeah, absolutely.
And it just talks about it in a really frank and honest way, doesn't it?
Yeah, that's what I wanted.
Is it doing well? It's doing
amazingly well. And that wasn't the reason I did it genuinely. I remember...
you make no money out of writing a book.
I remember Pat Dively, who wrote a book, and I just rang Pat and I said, Pat, what's this like? And he said, Mary, it'll take 2 years. And I thought, God, I'll do this in a few months. But he was right. It takes 2 years. And he said, you won't make money out of it, but it does raise your profile. But what I wanted to do was And thank to Sarah Lydian Gilbooks for taking it on, and Jennifer Stevens. They were fantastic, and they gave me great guidance. They were amazing. And basically, I just wanted an education about there. I felt if women and men were educated about, you know, hormonal health, it would really help. And particularly taking women from, you know, because periods, it just was never done before, and they need to know what's normal, what's abnormal. I mean, none of us were told. Many times do we see girls being sent home with hot water bottles or lying on a hard surface with her tummy because she had a dreadful period. You know, it was horrendous when you think about it. And this needed to be brought up. And I always believed if someone changes the narrative, then, you know, people are afraid to say things. But once it's said, it's out there, and then someone will take it on and someone will do something about it. So, you know, hopefully this will address and change, and women will now go into their GPs and say, look, I want my daughter sorted, or this period is too long, I don't want this. And it'll create research as well, because, you know, it'll be realised, hang on here, we've huge power. Women are longer going to be just shoved off and said, you know, put
it's
up
all
with
in
it.
Your head.
And the period will get better the minute you have a baby, which in some cases it does, but in the majority of cases it doesn't.
Isn't that insulting?
No, it's desperate, but that's what's still being said to some women. So someone had to take that on. I felt this book did it, and it was a great medium to do so, to engender change, but also to educate men and women about their daughters and the daughters themselves. So I want to do that. Obviously, you know, I wanted to talk about perimenopause and did that. And then I think in the book I address all about chronic fatigue, which I have a huge interest in because it was so badly treated and women were so badly treated.
Is that ME?
Yes.
Okay.
But we've sort of got rid of, ME is sometimes used, but I like to think of it as pituitary fatigue, because that's what it is. It's the pituitary gland exhausted due to glandular fever, due to COVID, due to burnout, due to whatever infection, and men and women suffer from it. And some women get it because of the periods are so heavy for so long as well, because it takes it out of their whole system. So that's the cause of it. But the lovely thing is that now, you know, it has been treating better because COVID came along. Up to this, a lot of people were fobbed off and said, oh, that's in your head. And I always say to patients, you know, Michael Flatley got really unwell and came out and said this. And, you know, thankfully he did come out, because he had to cancel tours worth millions. Yeah. And, you know, and thankfully, look at he came back up again and got better. So you can get better when you treat it. But so many patients were fobbed off and told there was no treatment. And of course there is treatment, and they do very, very well, but they have to do the whole holistic thing, as I told you, in addition to the treatment. And then are
drugs a part of the treatment as well?
Yes, absolutely. When people get to that stage of absolute exhaustion, desperate muscle pain, yeah, they do need medical treatment. A combination, it all depends. Some of the patients might have thyroid that's not properly treated. I'd often see that. Some patients would, desperate peripheral nerve pain, migraine, they might need the low dose amitriptyline, low dose gabapentin, just low dose to get that hormone right at every nerve and get rid of the muscle pain. And they do very, very well. But they'd also, some of them might just, the diet would also need to be addressed. It might be too high in processed food, too high in sugar. So that would help. And then major lifestyle change. Most of these people are overdoing it, so they'd have to pull back, you know. So it's all about that. And then I think I spoke about thyroid, which we've covered. Polycystic ovary disease I covered. And I think have a whole chapter to self-esteem, because I wanted to get at the root cause, which I felt was the root cause, is that lack of self-esteem in men and women. And to you know, I think if you open up people's eyes to it, they understand it, and then they make the change. So it's all about changing the narrative, making people see that what's the problem, and then they just drive on. Okay. That's what I wanted.
Well, you managed to do it, and it continues to grow. And I just
Laura.
hope that every young girl in this country gets given that book, and every woman gets empowered by it too.
Yeah, thank you.
Mary, before I ask you your last two questions, I'd like to know, because you are such an amazing lady, is there a little bit of love in your life?
No, I would love it. You know, that's something that I'm great giving the advice. And for the most part, I do. I'm good at going to bed, and I'm good at eating healthily. No, I haven't done that yet, but that's something I will do. I think I was taken up by the three kids so much. Yeah. You know, as a single parent, you're so busy with everything. And I love my job. So I'm so busy in jobs, so busy with the parents. I hadn't time. I would love that.
Just a companion.
Yeah, I'm real romantic. So I am a real romantic. So
we all
I would
need a little bit of love.
I think it's lovely. I think it's lovely, and I would love it. And I think, as you said, yeah, going to concerts, going to whatever, it would be lovely. I'd love it. Yeah, yeah.
See, it's all online now, and these dating apps and stuff like that, which is different to what you know you would have. known to be what dating was. Isn't that right?
Totally. Yeah. Oh, I would love.
Well, listen, here's a call out, right? Any distinguished bachelor out there that wants a beautiful, educated, funny, witty, gorgeous woman, you can contact me and I will screen you and only send the best over to you, Mary.
Thank you, Laura. You're so good. You've saved me a fortune there. Thank you so much.
Mary, can I ask you what advice you give young people today?
So advise young people today to really realise they've only one life, right? When you're 14, 15, 16, you think you're immortal. In fact, I still think I'm immortal, right? But in actual fact, we've only one life. And I'd like you to find yourself at a young age. And I see a lot of people finding themselves at 50. And it's never too late to find yourself, but I'd love that they would use the time they have just to really find who they are, and to grow as a person and be very high in self-esteem. I think working at the self-esteem is huge, because I often, when you meet somebody with high self-esteem, they always say, I know exactly what it is to me. I'm so happy. But that is actually in essence what self-esteem is. It's loving yourself, knowing the boundaries, being well able to say no. And once you do that, you are actually happy. The unhappy person is the person that, is saying yes to everyone and not looking after themselves. And as in so doing has been walked upon, because if you're a yes person, people take you for granted and they trot over you. So as a young person, I'd love you to, be wide open to listen to the guidance to the peers above you, your parents in particular, and all the mentors, but also there's so many lovely podcasts out there, telling you how to live your best life, but also to have a bit of, always never be what's the word I'm saying, be questioning as well. It's fine to be questioning and to check things, and is that right, because there's so much coming at you that you could be misled. So always have that open mind as well, but be guided by peers and mentors that are genuine, but to realize that as well as that you've only one life, and to live your best life, and always to be safe. And so that's what I say to my kids, and to be good to people, to respect people. I think if you're respectful as a person, as we said earlier when we were chatting, you get back what you give out for the most part. And if the person you're good to doesn't get you, someone else will get it. Yeah. But I've always said that to my own children: be respectful, be good, because I don't ever want to. Even had a woman in yesterday, and she said her child is 32, and she said, I know she's very close to me, he's moved out now, and I was saying, how are you finding that? And she said, I'm going to miss him dreadfully. But she said, Dr. Anne, if he comes in and if he says anything like use a swear word, she'll say, listen here now, that wasn't tolerated here, so I'm not going to listen to it, even though he's 32. Yeah. And I would do that too, because it's about boundaries and about saying I love you to bits, but listen here, always stay respectful. So I think that's a good, because what you want your children to be, and all society to be, is respectful of each other, good to each other, and but love themselves at the same time, and that's really important. That's what I'd say.
That's a lovely message. Yeah. And Dr. Mary Ryan, what is the meaning of life?
The meaning of life for me is to we're put on this life for a reason. We need to really live our best life. It's not an easy one. I had tough times, but thank God I got through them. But the meaning of life, I think, is to find what you're to be and be it. And what's lovely nowadays is we don't have to stay. We all went into one career like you did. Yeah. But thank God you can pull out of that, and there's so many avenues available that weren't available before, which is wonderful. So to follow your dream, never think that you can't have it. No matter what you want in life, you can get it, as long as you don't trot over people, which I wouldn't want. But you can attain whatever you want once you have that self-belief. That's absolutely true, and I've certainly done that, and you've done it as well, Laura, which is lovely. So the meaning of life is to be the best person you can be good to people along the way. I'm a big believer you get back what you put out, and constantly to be learning, constantly to have an open mind. And even I get this from my children, where they would check me and I would take it, because we don't ever see ourselves from the outside. And I love people being honest with me, not insulting me, but being honest with me and saying to me, Mammy, maybe you should have done this or that. And I love that now, because my boys are 19 now, and I like that. And once they put it nicely, it's all how it's phrased. And we're always learning, and that's lovely. So I think that's the meaning of life for me.
It has been an absolute pleasure. We'll have to get you back.
Thank you, Laura. Thank you so much. You're a brilliant person as well, remember.